Hi, I'm Krista Dickerson. I am founder and CEO of Green Imaging, and I'm a practicing radiologist, a practicing physician as well. I founded Green Imaging over 10 years ago to provide affordable medical imaging for both for individuals and for employers, because the cost of imaging has just gotten out of control, and even had 10 years ago. It's much worse now. But I had run an employer healthcare plan when I was president of a multi-specialty group, and I knew that this way of doing things a little differently could really help both employers and employees. Green Imaging is a zero out-of-pocket plan. So if you go down the hall at the hospital or where your doctor sends you, it's not a Green Imaging facility, you're going to be subject to your copay and deductible. If you use Green Imaging, you're going to have zero out of pocket. And there's no special sign up that's needed. Your employer has taken care of that. So if you're watching this video, you're a member of our health plan. And even the people in your company who are not members of the health plan can access us as self-pay. So if you have family members, friends, you can tell them about Green Imaging and they can access us as self-pay. But your employer has done this on your behalf and is paying for this imaging. When your doctor orders an exam, typically they send 70% of doctors in this country are affiliated with the hospital system, and they just use their EMR and send the order over to the hospital imaging center. Now, a doctor cannot insist that you use their imaging center, and they may say, oh, the quality is not going to be as good. You know, that's wrong. In fact, there is an inverse relationship between cost and quality in healthcare in this country. And we are typically using the same machine, and it may even be the same radiologist reading the exam. We're very particular about quality at Green Imaging. So instead of sending it down the hall, ask your doctor for a prescription and take a snapshot of both the prescription and your benefits card and text it to Green Imaging's main number, which is 713-524-9190. And that will initiate the scheduling process. If you send your name, date of birth, and some good times for the exam, that will speed up the process. But very quickly, whether it's sent to us directly from your physician, it can be faxed directly to us as well, or you text it across, that will start the scheduling process. And one of our 5-star concierge will contact you and make sure you're well taken care of. If they need to go down the hall at the hospital and track down that order on your behalf, we can do that as well. It is very important to us, the concierge experience, because it's something that you don't really get elsewhere and you don't get in the hospital system. We know that under times of healthcare stress, it's really nice to have somebody being your Sherpa, helping you get through and navigate the system. You will receive a voucher that you will take to the imaging facility. It's just a reminder to you and to the facility of how this works. It's going to have the name of the facility, the address of the facility, the name of the exam you're having, and any reminders or preparation you need to do for the study. Like, this one says, please remove all jewelry and arrive 20 minutes prior to the appointment. That would be an example of that. It also reminds you not to present your insurance card. You're not using your traditional insurance, you're using your Green Imaging benefit. And, the process other than that is going to happen the same way it does when your doctor sends it down the hall. A radiologist is going to read the study, the report's going to go to your doctor, and you'll get results from your doctor just the way you would at the hospital system. Occasionally, our members forget and do show their insurance information, or their insurance is already on file with the facility, and they do receive a bill. If that happens, just take a snapshot of it and send it our way. You can text it back to us at 713-524-9190, or you can email it to us and we will handle that on your behalf. We'll make sure that Green Imaging gets charged for the exam. And we are a national network. Even if you're a California resident and you've got your family's traveling, or you have a kid in college, we're going to have, or wherever you're a resident, we're going to have imaging options for you. Where we don't have a covered center, where there are holes in the map, we actually go shop for care on your behalf. So remember Green Imaging, it's really important right now. The costs, the pricing of imaging pre-pandemic is so much higher post-pandemic. There have been so many mergers and acquisitions in both the radiology group world and in the imaging center world. In the last set of claims data, which is data that we see what was paid for in a health plan, the average x-ray was over $500. The average ultrasound was over $1,300. Things that used to be cheap are not cheap anymore. So be sure, since you've been given this great benefit by your employer, that you learn how to use it and use it. We look so forward to hearing from you and working with you. Take care.